Hey, hey. See, I just got good news. They said that my nephew has started to walk. Oh, he turned 1 year like 2 days ago. Like, you see the joy, and that's the joy that every parent feels whenever their child reaches an important developmental milestone. So today I'm going to be talking about developmental milestones and how much joy they can bring, when they are delayed, and when you should worry about the fact that a child has not achieved a particular milestone at a certain age. When it comes to monitoring children, we talk about growth and development. Growth is when they're increasing in height, increasing in weight, and they're getting more and more robust. But development is a different ballgame. Development is when a child achieves certain traits at a particular age. Development can be quite interesting, but it gives parents a lot of cause for concern, especially when the children don't achieve certain developmental milestones at the age at which they're expected to do this. Development occurs in 4 basic areas: the gross motor, the fine motor, the speech, and the social. So let me break it down. The gross motor is things like walking, crawling, sitting, standing, jumping. The fine motor are the things that they end up doing with their hands. Things like picking up a pencil between the index finger and the thumb. Things like passing a ball from one hand to the other. Social developmental milestones include things like smiling back, playing peekaboo, waving bye-bye. While speech development includes things like dada. They always say dada first. Mama, things like when they talk. So those are the 4 main areas of development that we talk about. Now I'm going to tell you why development monitoring is important and some of the red flags that we can actually come across when it comes to speech development. As we know, children continue to develop up until the time they are around 5 to 7 years old. So monitoring development of children is very key, especially when they are less than 5 years old, which is why it's important for you to go for what we call the well baby visits, where we'll ask you questions like, has baby started crawling? Have they started waving bye-bye? What words are they saying? How many words are they saying? Are they repeating things after you? All this helps us to know if baby is achieving their developmental milestones at the age at which they should. And if they are not, it might be a red flag, and we need to find out why that might be happening. As we've already said, developmental milestones can be a very wide topic, and if I was to talk about all the developmental milestones, 2 hours will never come out here. So I would like to actually talk about maybe some of the most important developmental milestones that we actually need to discuss, and that is the speech area of development. I think the most frequent questions that I get when it comes to, Dr. Renner, I'm worried about my child's development, is when it comes to speech. Dr. Renner, my baby is 1 year old and is not saying anything. When it comes to speech, here are some of the red flags to look out for. If a child is not babbling at all by the age of 12 months, then that is definitely a red flag. A child who has no words at all by the ages of 16 to 18 months needs evaluation by a doctor or a pediatrician to make sure that there isn't anything unusual happening there with him. Because no words by 16 to 18 months is definitely a red flag. You might not think much of it, but a child who is not responding to their own name by the age of 12 months, that's a red flag. They should at least be turning their heads to the sound of their own name. Another red flag is a child who is about 2 years old that doesn't have the number of words in their vocabulary that we expect. So what do we expect? We expect that at 2 years, a child should have around 200 words in their vocabulary. And we're talking a child between 2 years and 3 years, which is why I always say, keep on talking to your babies. It doesn't matter what you're saying to them, just keep talking. It doesn't matter the language in which you're saying it to them, just make sure that you keep on talking to them, because the only way they will actually get those words in their vocabulary is by listening to you. And read to them, because reading to them is another great way of actually getting them to acquire all those words. So point at objects, tell them the name of objects, and that helps them to acquire all the speech and communication skills that they need. If at any age, a child who had certain speech skills loses them. So for instance, a child who was actually able to say dada, mama, who was making 2-word sentences like come here, go there, up nepa, please. If they lose those skills, that's definitely a red flag, because we expect that they should be progressing as long as they are hearing and communicating. But if they lose speech milestones that they have gained, that's a red flag, and you absolutely need to go to the hospital to have your child evaluated. I know that I've covered only speech in this particular episode, but if we had to go through all the developmental milestones, that would take quite a long time. But what I'd say is that one of the ways, or the only way, in which a person is able to acquire speech is by hearing. And so if you think your child actually has a speech delay, one of the first things that we do as doctors is to send them for a hearing test to make sure that truly they are hearing. If the hearing is fine, then we can send them to other specialists like the ear, nose, and throat surgeon, like the speech therapist, to make sure that they get the best start and to make sure we find out what might be going on and they have the opportunity to correct whatever it is that might be happening. So if you think your child has a developmental delay in speech, don't hesitate to complain to your doctor or to your pediatrician so that we can find out what might be going on. I hope you've had fun listening to all of this. Please make sure that you go for your well baby clinics to find out if there are any developmental delays, and I'll see you on the next episode.